Good morning, I am Brian and this is Rude Approach. Rude Approach theoretically based on the reflex and hierarchical model of motor control that was developed by Margaret Rood in 1940. Rude Approach is a neurophysiological approach that is intended for a patient who has a motor problem. It affects the motor control of a person and it includes the reflexes. There are four principles of Rude approach. These are normalization of tone, ontogenic developmental sequence, purposeful movement, and repetition of movement. Rude approach developed neurorehabilitation that is called facilitation techniques. Facilitation and enhancement of muscles activity can help to improve the motor control. Facilitation techniques was introduced by Rude that can be used for neurological rehabilitation. The following are the list of facilitation techniques. These are tapping, brushing, icing, passive stretching, and compression.
The Bobat concept was one of these approaches. It is founder Berta Bobat, a physiotherapist, and her husband Dr. Karil Bobat. The Bobat had the ability to learn from the experience and to adapt their concept to the changing needs of their patients. This ensured that the Bobat concept developed into a treatment approach that is relevant today. It is one of the most widely approaches. Bobat is a type of physiotherapy treatment which aims to improve movement and mobility in patients with damage to their central nervous system, their brain, and their spinal cord. So many physiotherapists use Bobat in rehabilitation of patients with neurological condition to promote the sensory and motor pathway and facilitate normal movement and motor control. The Bobat concept continues to develop in concordance with the changes in the presentation of individuals with different neurological conditions. Bobat also changes with the emergence of new theories, models, and information. Bobat physiotherapy will help improve movement and mobility using a combination of techniques involving passive and active movement in a functional way in order to obtain functional independence. Bobat physiotherapy will help make every task a great deal easier and improve quality of life. The physiotherapists are experienced in treating patients with neurological condition. Physiotherapy treatment is enjoyable and effective, emphasizing a friendly and caring approach, which means that you can be confident that you are receiving treatment of the highest quality.
What is Bernstrom? Bernstrom approach is a widely used movement therapy approach used by the clinicians. And this approach highly focuses synergic pattern of spastic muscles on the recovery of stroke patients through the various stages. And now let's go to the history of Bernstrom. Signe Bernstrom, a Swedish physical therapist, developed this approach in the 1960s. Her work on hemiplegia was based on various traditional neuropsychological theories of the motor control. And she tried various reactions to each procedure or from observations of the patients. And these are the several methods or rehabilitations of stroke patients. However, very little evidence is present.
Thank you very much. And now let's proceed to the next one, which is the PNF stretching. So one of my insights about PNF stretching, or what we call proprioceptive neuromuscular facilitation, it is a stretching or exercise that has more advanced form, especially in flexibility training. And PNF stretching is usually developed by psychotherapists as a method of rehabilitating, especially for those people who encountered stroke diseases, because it can help them to cope up from stroke diseases by doing PNF stretching or exercise. However, PNF stretching can also help athletes to enhance and improve their performance because we all know that every athlete should warm up first. So, PNF stretching is suitable for athletes. And that's all. Thank you.